Welcome to another myth busting with Dr. John. Okay, now I'm gonna put this back and be serious. Alright, go ahead. What are we myth busting today?
BBLs.
BBL myth busting. Brazilian butt lift for those of you who don't know what it is.
Okay, so people say that petite or thin women cannot consider BBL.
That's actually not true. I have done very many petite, thin women. We can find fat in places where you didn't know you had it. Obviously, we're gonna check. Some people don't have any fat. We can't do it. But if we have enough and we have enough skin and space back there, we can still do it. Give you a nice shape.
You will lose a lot of weight after.
No, because what we're doing is we're taking out the fat and putting it back in again. So technically, we're not losing any weight at all.
A BBL always looks fake.
No, it depends who does it and how they do it. If your results are natural, obviously, if you want a gigantus bum that doesn't look realistic, yes. But I like to sculpt it really nice, make it look like it's natural.
The fat doesn't survive.
Up to 40% of the fat can die off, but then that leaves you 60% left over. If you do really good filtration and you have a really good machine for harvesting, most of it will survive.
This is the most deadly plastic surgery procedure.
I think statistics are still haven't changed, but techniques have changed, and I think this needs to be relooked at again. Because now, for example, as I said before if you look at my educational video on BBLs, we use a closed sterile system, so anything we suck out comes back in again sterile, so the fat is sterile, there's no room to get an infection. Secondly, for the other reason that BBLs were dangerous and deadly in the past was because of the risks of getting an embolism, a thromboembolism, fat embolism. That happens because with the cannula pierce through a blood vessel and a piece of fat goes and causes an embolism somewhere else in the body. We use blood cannulas now. I think everybody uses blood cannulas now, so the risks have really, really dropped. They're there, but it's a lot rarer now.
Fat survives better when it is injected into the butt muscle.
No, you don't want to put it into the muscle. You put it between the skin and the muscle, so you fill that space.
Only women can get BBL.
I'm trying to think now if I've ever had a guy get a BBL. Guys can get BBLs too, so if you want it, you can get it. But it's true, mostly it's female patients that want to get BBLs. Is that it?
Yeah.
All right, so we're done. Stay tuned next week for another myth busting with Dr. John.